Good evening, guys. Tonight I have discussion D for you. We are discussing 10 priorities to help seniors. Okay, here we go. You can make measurable difference by combining practical help, transports, meals, home safety, social connection, regular visits, tech help, intergenerational programs, and system level action, advocacy, service navigation. These 10 priorities matter now because the older population is growing rapidly, social isolation and health risks are rising, and communities must adapt to keep people safe, independent, and included. Quick guide: how to start key conversations and questions. Decide scope: one-to-one support, neighbor, program, or advocacy. Ask who needs help. What do they want? What local services exist? Partner: contact your area agency on aging or local senior center to match needs to services. Senior safety advice: 10 meaningful ways to support older people. What do they what what to do and why it matters. 1. Regular social visits and phone check-ins. Why? Social engagement reduces loneliness and improves mental and physical health. 2. Provide or coordinate transportation. What? Volunteer rides, help with booking, paratransit, or accompany to appointments. Why mobility preserves independence and access to care. Ensure safety, ensure safe homes and fall prevention. What? Install grab bars, remove trip hazards, arrange home safety assessments. Why? Home modifications, cut hospitalizations, and support aging in place. 4. Connect people to reliable nutrition programs. What? Link to Meals on Wheels, congregate dining, SNAP help. Why? Food scarcity prevent food security prevents malnutrition and readmissions. 5. Teach digital skills and provide tech access. Help set up video calls, telehealth, online banking, and simple devices. Why? Digital inclusion reduces isolation and keeps people connected to services. Create intergenerational and volunteer opportunities. School partnerships, skill share events, mentorship. Why? Builds purpose, transfers knowledge, and strengthens community bonds. 7. Help navigate benefits and health services. Assist with Medicare local programs or finding home care options. Why? Complexity of systems is a barrier to care. Navigation improves outcomes. Eight, organize neighborhood check-ins and emergency plans. Phone trees, buddy systems, heat and cold weather check-ins. Why? Climate extremes and disasters disproportionately affect older adults. 9. Advocate for age-friendly public spaces and policies. Push for benches, curb cuts, accessible transit, and local aging plans. Planning now prepares communities for a rapidly growing older population. 10. Support family caregivers and respite services. Offer respite, meal trans, or help with errands. Why? Caregiver burnout undermines long-term care capacity and well-being. Risks, limitations, and practical safeguards. Scams and fraud. Verified callers. Never share personal or financial info. And use trusted local agencies for referrals. Boundaries. Respect autonomy. Ask before acting. And prioritize what the older person wants. Sustainability, recruit volunteers, partner with nonprofits, and seek small grants to scale efforts. Next steps for Meadville practical actions. Call your area agency on aging or elder care locator to map services and volunteer opportunities. Start one simple action this week: a phone check-in list, a neighborhood safety walk, or tech help sessions. Bold summary: the engaged best practices for helping older adults stay socially engaged. Updated September 22, 2025 is more than a checklist. It's a national blueprint for building connection, belonging, and resilience among older adults. It highlights scalable program models, hybrid, in person, and virtual engagement, and across sectors. Partnerships that any community can adapt. Use, use its toolkits to design programs that reduce loneliness, strengthen health, and create measurable, lasting impact. What the resource is and why it matters. Engaged, the National Resource Center for Engaging Older Adults, curates evidence-based models, toolkits, and replication guides that help communities build stronger social engagement ecosystems. The September 22, 2025 update reflects the newest research on aging, digital inclusion, and community health. Why this matters now. Social engagement is not a luxury, it's a protective factor linked to better physical health, sharper cognition, and reduced depression. As older population grows, communities must shift from communities from activities to intentional date-driven programs that reach people where they are, online, at home, or in neighborhood hubs. The brief gives communities a ready-to-use roadmap for doing this well. 10 evidence-based best practices and how to apply them locally. Design hybrid programs in person or virtual. Blend neighborhood meetups with Zoom circles, teleclubs, or virtual classes. This ensures homebound adults, caregivers, and rural residents aren't left out. Hybrid models also build resilience during weather events or health disruptions. Use community partnerships, libraries, senior centers, faith communities, arts organizations, and health systems can co-host events, share volunteers, and cross-promote programs. Partnerships expand reach without expanding budgets. Prioritize digital inclusion. Provide tablets, simplified interfaces, Wi-Fi hotspots, and patient tech coaching, digital conferencing unlocks telehealth, online learning, and social connection, especially for those who can't travel easily. Offer integrational activities, story exchanges, reading buddies, skill sharing workshops, and mentorship programs build purpose and mutual respect. These activities counter stereotypes and strengthen community cohesion. Measure outcomes. Track participation. Loneliness scales, satisfaction surveys, and referrals to services. Data helps refine programs, secure funding, and demonstrate impact partners and policymakers. Adapt for accessibility. Use large print materials, caption videos, hearing looped systems, uh, mobility friendly venues, and transportation supports. Accessibility ensures inclusion rather than accidental exclusion. Embed nutrition and physical activity. Pair social events with congregate congregate meals, cooking demos, walking groups, or chair yoga sessions. These integrates models support whole person wellness. Train staff and volunteers in mental health awareness. Equipped facilitators to recognize signs of loneliness, grief, depression, or cognitive changes, and to connect participants with appropriate services. Use targeted outreach for underserved groups, rural residents, low income, older adults, LGBTQ elders, and culturally diverse communities often face additional barriers. Tailored outreach, trusted messengers, translated materials, culturally relevant programming closes gaps. Scale with seed grants and pilot projects. Start small, a weekly conversation circle, a tech help hour, or a phone check program. Evaluate, refine, and expand engaged highlights, uh, replicatable models, and funding pathways to help communities grow substantially. Why these 10 points matter more than ever. Demographic pressure. The 65 plus population is expanding faster than community infrastructure. Without intentional planning, social isolation will rise. Health implications. Loneliness is associated with poor physical function, higher healthcare use, and increased mortality risks. Social engagement is a preventative health strategy. Technology dependence. Telehealth, online service, and virtual communities are now woven into daily life. Digital exclusion is becoming a form of social exclusion. Climate and mobility challenges. Weather extremes, transportation gaps, and caregiver shortages make flexible, hybrid, and community based models essential. Okay, guys, that is your shows for now. I will see everybody maybe later for another show. For now, Gator Wellness. Take care, folks.